Welcome to the list of definitions on some psychiatric disorders. First, organic psychiatric disorders are those which are due to a known organic cause. They are also called as the organic brain syndromes. Delirium is one of the most common presenting symptoms in psychiatry and it is characterized by an acute onset and disturbance of somatic functions as well as some psychiatric symptoms like illusions, misinterpretations, hallucinations, and so on. A disturbed sleep cycle as well as agitation and some autonomic dysfunction can also be present. Mood is defined as a lasting and a dominant emotional response which colors the psychic life, while affect is defined as an immediate, short-lived emotional response to an event. Hallucinations are defined as somatic, auditory, or visual perceptions which arise out of chronic, high-dose use of any drug or substance. Delusions are ideas or fixed beliefs that are held by a person despite real evidence to the contrary. There are various types of delusions like delusions of grandeur, delusions of persecution. Neurosis is defined as the presence of a symptom or many symptoms which cause subjective distress to the patient. The symptoms are undesirable and personality behavior may be affected and contact with the reality is preserved. Anxiety is defined as a normal phenomenon which is characterized by a state of apprehension or unease arising out of anticipation of danger. For example, anxiety before an examination, anxiety before organizing an event. Chronic anxiety is defined as an anxiety of insidious onset and which may persist for a long time and may be characterized by repeated attacks of acute anxiety. Agoraphobia is defined as an irrational fear of situations. Other common types of phobias are social phobia and simple phobia. Often women are affected more than men in agoraphobia. An obsession is defined as an idea, impulse, or an image which intrudes into the conscious awareness but is recognized as one's own image. And though irrational or absurd, the person tries to resist it and is unable to do so. A compulsion is defined as a form of behavior which is aimed at preventing or neutralizing the distress or fear arising out of an obsession. Though the behavior may not be realistic, the person is forced to perform the behavior in order to alleviate the symptoms. Hypochondriasis is defined as a preoccupation with a fear or belief of having a serious disease based on the person's own interpretation of normal body function or a minor physical abnormality. Depersonalization is characterized by an alteration in the perception or experience of self so that the feeling of one's own reality is temporarily changed or lost. Derealization is an alteration in the perception or experience of the external world so that the feeling of reality of the external world is temporarily changed or lost. And now we come to the list of definitions on drug and alcohol disorders. Starting with drug. Drug is defined as a substance which when inhaled, ingested or applied or injected into the body for the purpose of diagnosis, prevention, treatment, causes to alter one or more functions of the body. Acute intoxication is defined as a transient condition following the administration of the drug which results in a disturbance of psychophysiological functions of the body, which are characteristic of high blood levels of the drug. Withdrawal symptom is characterized by a cluster of symptoms often specific to the drug used and which develop on total or partial withdrawal of the drug administration after repeated and high dose drug use. Drug dependence is characterized by the presence of tolerance to a higher dose of the drug which is constantly being administered or self-ingested for a long period of time, and the presence of signs of withdrawal symptoms when the said drug or substance is withheld. Drug abuse is defined by continued use of the drug, usually in ascending order of doses, and a pattern of physically hazardous use seen in the person despite evidence to the fact that the drug in high doses will cause harmful physiological and or psychological effects on the body. Compulsive drinking of a drug or any substance over a long period of time is known as dipsomania. Wernicke's encephalopathy is an acute reaction to severe thiamine deficiency and is characterized by a wide range of symptoms, both physical and psychological. Example is chronic alcohol use. The deterrent agents used to treat the symptoms of alcohol withdrawal are known as alcohol sensitizing drugs, such as disulfiram. Detoxification is a process where the administration of a chronic drug is stopped and the treatment is given to the symptoms which arise out of withdrawal of the drug.